Hi, everybody, and welcome on behalf of Nottingham and Nottinghamshire CCG's webinar on vaccination, COVID vaccination in maternity services for pregnant women. Well, we're just going to wait for a few more people to join, so we'll just keep going and waiting for a few more people to join us before we start with the presentation. The numbers are still coming up, so I'm just going to wait another minute or so, and then we will start. And get the next slide on, please. Ready. Fabulous. Thank you, everybody, for coming and joining us. So I think more people will be joining as they go. But welcome on behalf of Nottingham and Nottinghamshire CCG to our vaccinations before, during, and during pregnancy and whilst breastfeeding. All information is correct as of today, which is the 20th of January 2022. Next slide. My name is Jen Moss-Langfield. I'm a GP. I lead for the maternity services within Nottingham and Nottinghamshire. And I'm joined by a variety of other clinicians who I will introduce as we come along to them. We have midwives, we have obstetric colleagues, so consultants, amongst others. Next slide. So I'm just going to start with going through a little bit about COVID vaccination, about having it before becoming pregnant whilst undergoing fertility treatments. So there's a lot of myths around this, and a lot of people are very worried about fertility and the COVID vaccination. And I just want to reassure you, there's been quite a lot of research done on this now from the start of the pandemic and started giving the vaccinations, but there is no evidence at all of any COVID vaccinations affecting fertility in men or women. Initial studies that were looking into this didn't actually recruit pregnant women, but there were loads of pregnancy occurred. And then as soon as we hit, I think it was January, we started being able to vaccinate women who were in healthcare. And then as of April, we've been vaccinating all pregnant women, and that offer's been there for everyone who is initially over the age of 18. So we've had a lot of information for women, both in pregnancy, before pregnancy, and after pregnancy now. So the chance of conceiving is not affected by the vaccination, and there is no increase or change of miscarriage rate at all. There are absolutely no ingredients that actually transfer across the placenta or are known to affect fertility in any other vaccines or medicines. And they've looked into ovarian reserve and sperm quality, and they haven't found there's any link to this being affected by vaccination. Interestingly, they have found that sperm quality itself has been found to be reduced by having COVID infection itself, but they have no problems with sperm quality after vaccination. Next slide. Some people wonder whether they should delay either going for IVF or delay trying to get pregnant until they've had either 1, 2 or 3 at the moment vaccine doses. But there isn't any reason to delay treatment or pregnancy in order to get vaccinated. And there's no need to delay vaccination, either. So getting vaccinated doesn't affect your chances of getting pregnant or miscarriage. It's just as safe to be vaccinated before pregnancy or within pregnancy at all. The safest thing is to be fully vaccinated by the time you are in your 3rd trimester, because that's the time where you have the highest risk to both mother and baby. So actually cracking on and getting started with the vaccination program as early as possible is the safest thing to do. One vaccine does give some benefit, but a full course, including that booster, gives much more protection. We found that especially with Omicron. Next slide. So previous research has found that other common vaccines like flu jabs and HPV vaccine can sometimes cause short-term changes in menstrual cycles. And so we don't really know exactly the mechanism of this, but it was really unsurprising that we found that people were reporting small changes in their cycles shortly after having the COVID vaccination. And actually, there's been some new research from the USA and Norway suggesting that that first period following a vaccine may be delayed up to 2 days, especially if, like thinking right back to the early start time when we were initially vaccinating with a 3-week gap between the first and second, but much less so with that bigger, longer gap that we're doing at the moment. And sometimes there was a different flow as well as a slight delay, but then that cycle came back into a normal routine by that next period, and then there were no residual effects going on. So although there is a slight effect on menstrual cycles and periods possible, it is nothing that's lasting long. Next slide. Interestingly, also, we have found that having a COVID infection as well can also affect your menstrual cycle. And we've heard that at least anecdotally. So vaccinations in pregnancy, what is the data telling us? We've had 185,000 pregnant women in the USA and over 100,000 in the UK have been vaccinated, with no increase in any complications in pregnancy, which is fantastic data. They're very good at protecting against moderate and severe COVID infection. At the moment with Omicron, we are seeing mild infections or asymptomatic infections in people who have been vaccinated, but the protection against that really, becoming really unwell with COVID is really good and coming through. The vaccination also can give your baby protection once it's born, because although the vaccine itself can't go across the placenta, the immunity that you get, those antibodies, can go through and then protect your baby before it's for that period of time where it wouldn't have had a chance to make its own antibodies. But the vaccines don't have any ingredients that are harmful, and it cannot give either a woman or a baby COVID-19 because it's not a live vaccine. Next slide. So it's safe at any stage in pregnancy, and there is no increased risk of miscarriage or preterm birth or stillbirth or birth complications or congenital abnormalities or growth restriction of the baby. And this is evidence from 13 studies in 5 countries, including more than 137,000 women who've been vaccinated within pregnancy. And I think actually we've got even more data showing that safety in pregnancy. We're going to go on to that more in a bit. Next slide. So every pregnant woman is eligible for a vaccine. And actually, on the whole, it's extremely rare for anybody to be not suitable clinically. There are very few people who have multiple allergies to ingredients within the vaccine. But apart from that, it is very rare for people not to be suitable to be able to have a vaccine. Hesitancy and uncertainty, these are the primary reasons why pregnant women are either unvaccinated or they're only partially vaccinated. For example, some pregnant women may have had a few vaccines before they were pregnant and now are hesitant over getting their booster, for example. In pregnancy, we're only using Pfizer and Moderna, and the only reason is that there's really good evidence, because that's what America, who started doing vaccination in pregnancy, did. They had the information that Pfizer and Moderna were safe in pregnancy, and so in the UK we are offering Pfizer and Moderna only in pregnancy because we can show how safe that is. Next slide. So just a little bit of an overview of what the program is. So dose 1 really is people should have had it, but if you haven't, it's as soon as possible. If you're not pregnant, before pregnancy, or if you are pregnant at any stage of pregnancy, it is that as soon as possible is the best. Dose 2 is 8 weeks after dose 1. It was 12 weeks, but they've brought that shorter with Omicron. There is also a third dose for people who are immunocompromised. So that's on various different medications there. And if they were immunocompromised when they had dose 1 and 2, they might not have built up as much of an immunity, of immunity from the vaccines. So they need a third dose to boost their immunity. Everyone, after they've had either dose 1 and 2 or dose 1 and 2 and 3 for those immunocompromised patients, everyone needs a booster 3 to 6 months after that last dose. Now, at the moment, they've brought that forward from 6 months to 3 months there, and that's because of the Omicron variant. But and so we just need to keep an eye on what those details are as they change. But yes, it would be getting it as soon as possible. So why is there a booster program? Now, initially, we started the booster program before Omicron came on. So initially, it was because they'd worked out after 20 weeks after your first 2 vaccines, only if you had 2 AstraZeneca, you only had 44% immunity. And if you had 2 Pfizer, it was only 62.5%. And if you boosted it, you're up about 93, 94 after either one of them. So that's the protection after 2 weeks of having a Pfizer booster, either on 2 AstraZeneca or 2 Pfizer. So having that third Pfizer booster. And it's the same for Moderna. Next slide. As we go through where you can get vaccinated, I'm going to come back onto Omicron in just a moment. So where people can get vaccinated, if you are pregnant, sometimes there is an availability of getting vaccinated in the antenatal clinic. And that's when you have a scan or an appointment with a consultant or midwife in hospital. So that's not when you go to a community clinic or the GP surgery to see the midwife. You can ask if when you go there, it may be that you can go down to the hospital hub there and get vaccinated, or there may sometimes be an offer within the antenatal clinic itself. But if you're interested, that's a really good opportunity to go and ask about it. You can book online. Anyone can book online. There are lots of available appointments at the moment. So you can book online to go and get vaccinated at vaccination centres, and actually on the hospital hubs as well, and community pharmacies. Now, at the vaccination centres, there is a GP who is available at both Forest Recreation Ground and Mansfield Vaccination Centre. And if you want to be able to have that one-to-one conversation where you can ask your questions and really be able to have that really good conversation and go through any fears you have, and get more information, then you can do that. And it's a really good shout to go to those vaccination centres. And actually, there's a walk-in offer at both Forest Rec and Mansfield Vaccination centres for pregnant women. And there's a fast queue for both the immunosuppressed and pregnant women, because we do realise that you don't want to be standing in a queue for a long time. If you want to, you can go in with your children. You do not have to find other childcare. You can bring them in through with you. It's not a problem. You can also book via your surgery, and this is based on what we call a PCN based service. So that's a local service that is it will be near your surgery, but it might not be within your own surgery, but it might be a surgery that's quite just down the road from yours. That's a primary care network PCN. It's just one of the it is a term we use in the NHS to describe a group of GP surgeries that work together. Next slide, please. So if you want to have a little look at the full list of sites, you can visit our CCG website. And if you could just Google how to get your vaccination and Nottingham and Nottinghamshire CCG, then you can find it via that. I'll ask someone to put that in the chat as well. So if you could just pop into the chat, you'll be able to find those lists of where you can get vaccinated. We have got some special pregnancy and postnatal vaccination clinics running at the moment. So there's some at the Forest Rec there. So that's on next week on the 25th, 9:30 to 12:30, and on the 29th, 2 till 6 p.m. and at Mansfield Vaccination every Monday 4 till 7 p.m. So it's a COVID secure environment, as all vaccination centres are. You can ask your questions and bring children, and I said there is a GP who is there who you can ask one-to-one questions with. I just want to mention flu vaccination for you. Now, we've been doing flu vaccination for 10 years in pregnancy, so this is not a new offer, but all pregnant women are offered a flu vaccination. Also, so children from age 2 to 15. There's also people who have certain health conditions there, and this may be relevant. Some of the other things may be relevant to other members of your family as well. And so if you have a little look at, there's a list of people who are eligible for one, but you can get that at your GP surgery or at your pharmacy. And those are the two main places for you to get to that. We also have an offer at antenatal clinic. So if you're coming in for a scan or you're going in to see a consultant or midwife, you can get a flu vaccination there. You can also get a whooping cough vaccine once you're over 16 weeks pregnant. Can I have next slide, please? So, and that you can have again at your GP surgery or at antenatal clinic. So that's just a bit more about flu vaccination for you and your family and where you can get it. Next slide. So we've just talked about that there, so I'll just skip on to the next slide. Now I'm going to hand over to Dr. Susie Al-Samurai, who is a consultant in obstetrics and gynecology at Sherwood Forest Hospital.
Thank you, Jen. So to follow on from what Jen's talked about the importance of the vaccination programme, I'm wanting to talk now about why we feel it's important and what the worries are around having the COVID-19 infection within pregnancy. We know from the data that's been gathered over the last 2 years that there is a much greater chance of you developing severe illness during the second half of your pregnancy. And the most recent data that was gathered between May and October of 2021, really showing the Delta wave, showed that we had nearly 1,500 pregnant women admitted to hospital. And unfortunately, over 96% of those women were completely unvaccinated. There was a very small proportion of approaching 2% who had had one dose, but very few women who were fully vaccinated required admission to hospital. And sadly, over 230 of those women, so 16%, required care within intensive care, and nearly 98% of those women were completely unvaccinated. It doesn't just affect the respiratory system. So we know that although 32% had pneumonia and 33% needed support with their breathing, nearly half of those women required a cesarean section to give birth. And very sadly, 1% of the women who were admitted to hospital died. So 17 women within that time frame. Next slide, please. So as well as affecting mum, we know that COVID is increasingly recognised to affect your baby. And it affects it primarily through the well-being of mum, but also it appears to infect the placenta and cause real inflammatory changes within that, which stops the placenta from functioning as well. So nearly 20% of babies were born prematurely, and often that was to aid the well-being of mum. And of those babies that were born prematurely, nearly all of them required admission to the neonatal unit, so they were separated from their mums. Really sadly, 2 in 100 babies were stillborn. Now that's a doubling of the normal rate that we would expect. And having looked at the placentas of those babies that were stillborn, there was the opportunity to identify COVID within those placentas, which appears to have contributed to those deaths. And very sadly, 4 babies died from COVID-19 between May and October, and that was following infection of their mums. In comparison to the previous waves, with the first wave, so with the original strain of COVID, 9 women died during that time. And with the second wave, with Alpha, which was this time last year, we saw 11 women die. Really sadly, the 17 women who died with the Delta wave have died despite vaccination being widely available and recommended very, very strongly. Next slide, please. So locally, which is important to people who are listening today, we're seeing a very similar picture to the national picture. We're seeing increasing numbers of women who are testing positive in pregnancy, and we don't have the protections in the community that we had in the first and second wave, with schools being open. We don't have any national lockdown. There is less mask wearing and far less social distancing going on. And most of the admissions of pregnant women to hospital and to our intensive care units with COVID are completely unvaccinated, which is identical to the national picture that we've seen. Really sadly, there are huge pressures on our neonatal units, which means that if those babies are being born to mums who've got severe COVID, are born prematurely and require that neonatal assistance, there are going to be extremely long distances needed to travel to find available cots to provide the appropriate care for those babies, which increases that separation. Next slide, please. So if you aren't unwell with COVID, which fortunately the majority of people aren't currently, there are still impacts of testing positive around the time of your birth. And we are testing women on admission to hospital, and there is pre-admission testing performed for elective cesarean sections to identify women who have COVID and are asymptomatic with that prior to coming into the hospital environment, because obviously there are other vulnerable patients present, to try and make sure that we're providing the safest care possible for everybody. If a woman tests positive, she'll be isolated and won't be able to have visitors to come to see her. She'll have her birth partner with her when she's in active labour, but only if they're not COVID positive as well. And if they are COVID positive, they may be allowed to stay for the birth, but then they'll have to go straight afterwards, which increases the separation and reduces that support that you need at that really vulnerable time. If your baby's admitted to the neonatal unit, they're also then isolated from you because you won't be able to go to see them because of your infectious status, to protect the other babies that are there. And what we want to do is to support families and babies being cared for together, and unfortunately being COVID positive at this time really disrupts that. Next slide, please. I'm going to hand over to Natalie Boxall, who is a specialist midwife around infant feeding, who is a colleague of mine from Sherwood Forest Hospitals. Thank you.
I am here, I'm just waiting to flick over.
I'm wondering whether there's a slight problem with Natalie's internet, so I'm just going to take over, and as soon as Natalie...
No, it should be fine.
Ah, good.
Can you hear me? Yeah, it's just the video, it's not switched over to me, that's all. So
there is an echo. If someone else has got their microphone on, can everyone else apart from Natalie mute, please?
So if you can't see me, that's fine. I'll just carry on and read this out for you. So if you have any questions about this at the end, please do ask, because I know this might be new information to you. But if you're breastfeeding or chest feeding, you don't need to stop doing this in order to be vaccinated against COVID-19. There's no known risk to being vaccinated when you're feeding your baby. And there's no safety signals in breastfeeding women, people or babies either. It's recommended by organisations such as the Royal College of Obstetricians and Gynecologists. And also in America, the CDC also recommends vaccination for breastfeeding women. There's also the World Health Organization states that vaccinating poses no risk to you or your baby. And this is backed up by a safety surveillance statement by the MHRA from September. And that said that no current evidence is there that says that it causes harm to breastfeeding children or affects ability to breastfeeding. Now, at the beginning, at the end of last year, there was some anecdotal information that came out from people who'd had the vaccine. However, this has been updated now, and there's been a study of 50 breastfeeding people in November and said that there's no severe adverse effects on people feeding their babies after they've had the vaccination. So that's a reassuring study that came out, and I will provide links to this if anyone wants to look them up as well. So as mentioned earlier, there's no way that any vaccine component can pass through a woman or parent's body into their milk. It just doesn't work like that. And there's actually been 2 studies looking for vaccine mRNA in breast milk, and it's unable to detect it. So there's no way that that's going to pass over to your baby. However, as mentioned again, a number of studies have shown that protective antibodies that your body makes to the vaccine does go into your milk in very high concentrations. So that's a really reassuring fact that you're passing that on to your baby who isn't vaccinated. And obviously, the other side of it, you know, your milk offers all this nutrition and comfort, but this protection is the other side of it. So your milk already, without the vaccine, offers protection, but having the vaccine gives extra antibodies and antiviral factors that's going to help destroy pathogens and boost the baby's immune system. And just if you're the type of person who likes a bit more info about this, the graphic here is from a study taken from people who'd had the vaccine, and then their breast milk was measured afterwards, and they looked at the levels of antibodies in their milk afterwards. So if you do have any questions, please do ask afterwards. That's more than okay. That's it.
Thank you very much, Natalie. Can we get the next slide, please? So I think that this is where we are. We're now going to go through some questions. I've got my video back on. So I'll get our panelists back, turn their videos back on there. And I'm just going to go through some questions. So who's got some of the questions for us to answer?
And just remind people to use the Q&A function to ask any questions, that would be great. But we've had a couple submitted beforehand, if that's okay, Jen, if we could open those up. So the first one is, can I have a COVID vaccination during any fertility treatment?
Absolutely, you can do. You know, you can get that before your fertility treatment, during your fertility treatment, or after your fertility treatment. However, I would be recommending you get it done before, if you do have the opportunity. I wouldn't delay your fertility treatment for it, but I would get it done before, because another implication of becoming COVID positive could be that you may have to cancel a cycle, because if you contracted COVID when you were just before having egg collection, even though you've gone through all of the whole thing, you would then actually be unable to go through with your egg collection because you were COVID positive. And that could have financial implications as well as to your health as well. You don't really want, no one wants to go through it and have it cancelled and then postponed. So yes, if you have the opportunity, get it done beforehand.
That's great, thank you. Another one that was submitted was, what if I have allergies? Should I still get the vaccine?
Yes, absolutely. So there are some people who have either very specific allergies to an ingredient that is in one or other of the vaccines, which may affect a vaccine that is possible for them. There's a very few and far between. Now, most people have got, for example, food allergies. So people who've got food allergies can have any of the vaccinations. There are certain specific vaccines that can affect being whether you can have a vaccine, and in general people already know that, because it will affect other vaccines that they would be also unable to have. But if you have any questions, you can either go to your GP surgery, you can go walk into a vaccination centre. That is one of the things we check really carefully. We really carefully go and have a little look at what allergies people do have, to see whether it is safe. But actually 99.9% of people who have any form of allergies will be completely fine to have any vaccination.
That's great, thank you. So a couple of questions have come through, so probably one for you, Natalie. Are there any further studies regarding breastfeeding following vaccination, as the study you mentioned only follows 50 women, which is a small sample?
So there is lots and lots of studies out there on, there's that one there was on its own, but obviously there's loads of other ones. What I've done is I've put a link in the chat box. There's an immunologist from King's College called Vicky Mail, who's been really helpfully collating the data on this and sharing it publicly, which is what that links to. So, and there's one of the sections where I couldn't actually unpick up, there was that many studies linking to it, but yeah, I know 50 is a small amount. However, and was that in relation to, the 50 was in relation to no severe adverse effects, wasn't it? So that's from women reporting that. The information that was out at the beginning was that some people, this was around November actually, sorry, November 21, so this has been updated since then. People did report the general flu-like symptoms that you might get after this, which is common for anyone. There was some anecdotal symptoms of mastitis and altered milk supply. Now, this was reported by the Breastfeeding Network, and they said that the reports of adverse events are limited, and there was no data at the time of the number of people who were breastfeeding vaccinated. So obviously that was November, and things move quite quickly in this. So that's why I've put the link to Vicky Mills' explainer, because that's even fresher.
That's great. Thanks, Natalie. I think there's another one that's just come through around breastfeeding as well, so it's over to you. Regarding transmission of substances through breast milk, how is it that elements of the vaccine cannot pass through the breast milk but antibodies can?
That's a really good question. As somebody who is not an expert on this in that section, what I was explained at the vaccination centre, I believe it's because the components of it are too big to pass through. I believe, people are nodding, excellent, it's just too big. If you, a really good resource for anything to do with drugs and breast milk is the Breastfeeding Network. So this is just as an aside, if you are taking any medication, they have a pharmacist called Wendy Jones, who is excellent, and they have fact sheets on everything. So on there will be more about that in relation to breast milk. So Breastfeeding Network, I'll put it up, but yeah, it's just too big.
Yeah, and I'll add in onto that one. Boobs are clever things. It's not just the sieve that some things go through. Some things are actively excreted into breast milk. So although some things can kind of sieve through and go through, so very small molecules and will be able to go in, but actually they create and excrete milk itself, and we have little, these little lipid droplets. And if you actually look at milk, breast milk, fresh milk, under a microscope, it's amazing. It's a living thing. It's the good stuff, and it's packed full of all these antibodies that with our body, as a woman, our bodies produce them, and we want to get that immunity to, and it could be for a common cold or any form of illness that we've encountered in our lives. We want to be able to get that into our child for them to be able to build up that immunity. So it's actively pushed out through. I think that we find that all the good stuff is being pushed through to mum, and they do include all of those antibodies that are produced from vaccination or from having an infection yourself. It's kind of much the same, really. Do we have any more questions, Katie?
We do, Jen. Yeah. So can I wait until later in my pregnancy to have the vaccine?
So you can wait until later in your pregnancy to have the vaccine. The worry that you've got then is that if that's your first dose and you're then waiting for a further 8 weeks to have your second dose, you may not get the best benefit of your full immunity by the time you become into that higher risk time of the second half of your pregnancy. So I'm going to quote one of my my previous colleagues who has talked about this extensively. The best time to get your vaccine is today. And if not, then tomorrow. But feeling comfortable about the decisions that you've made, feeling that you've had all of the information to have the questions that you've got answered is really, really important to support that decision-making process. So having the opportunity to ask your questions, to get the answers that you need, and then accessing that appointment when you can is really vital. So if you turn down your vaccine at week 12, nobody's going to say no, you can't have it when you then next ask. So please don't feel worried that if you turned it down once that you can never have it. It's an evergreen offer. You can have it at any time, but the earlier the better from our point of view.
Great, thank you, Susie. Another one that's just come through is, I've had my flu vaccination, can I still have my COVID vaccination?
Absolutely, you can. You can have them at the same time. In fact, you can have your whooping cough, flu and COVID vaccine all at the same time. Now, that may sound a little bit crazy, and why would you want so many vaccines there? However, if I just remind you what we do with children. So when your child is 8 weeks old, they go for their first set of immunizations, and I think it's 5 or 6 that they have packed together, not in 5 or 6 separate injections, but the immunizations for the conditions. So and quite regularly we'll have 4 vaccines delivered, actual injections in that childhood vaccination program. And actually it's quite a lot of what we've done with the vaccination program for COVID is based on that childhood vaccination program. So having a dose and then having another dose later on to boost that immunity, and then having another one a little bit later to further boost it and build on that immunity. So we've taken those lessons, and we keep on going and working out how we can do things the safest. So yes, please come and get them both done at the same time. Good places to get those done at the same time would be sometimes in antenatal clinic, depending on time of year. Now you may be watching this way in the future. We're currently in January and we're still in the flu season for this year, but if it was in July, you wouldn't be able to get a flu vaccination in antenatal clinic, but you would hopefully be able to get your COVID vaccination, or at least be directed to where else you could get it. General practice, again, you can get those done at the same time. Vaccination centres, they are at the moment only giving the COVID vaccine, but your pharmacy, your community pharmacy may very well be able to give flu and COVID, probably not able to give you your whooping cough. Just a little bit of an oversight on that.
Thank you, Jen. Another question is, will I experience any side effects from the COVID vaccination?
So yeah, side effects from any vaccine some are common and some are very rare, and there are some in between. So it is very common to get a little bit of a sore arm, and that can vary from, I just feels like I caught it on the car door, to actually that hurts a bit, that's really quite sore. Some people also get some flu-like illnesses, so well, not illness, sorry, I'm using the wrong word, so flu-like symptoms. So you can have a fever, and that and you can feel lousy, you can feel aching all over your body and feel a little bit rough. Headaches are also reasonably commonly reported. But all of these symptoms, they usually start, maybe 6 to 12 hours after having a vaccine, and will go by about 48 hours afterwards. It's very unusual to have any side effects that go on later than that. There are some very rare side effects that have been reported. All of the vaccines that have ever been, all the side effects that have ever been experienced, we are encouraging people to tell your GP, tell your doctor, so we report that and we can build up the evidence and the information so we know how often these happen. But they are very, very vanishingly rare.
Thank you. Another question that's just come through is, if I have any questions about the vaccination, who is the best person to speak to about these concerns?
So I think it depends what your, if it's generally about vaccinations, your GP is a good person. Walking into a vaccination centre, there are a whole load of questions that they go through with you, and all the people who are doing that assessing, they've got good answers as well. You can, there are some really good frequently asked question resources on the CCG website, and I'm going to get someone's going to pop that into the chat as we're speaking, so you'll be able to find those. But yeah, and the pharmacist, so if your pharmacist doing COVID-19 vaccines, that's another really great and convenient place to go and ask those questions face to face with someone, so you can get those answers.
Additionally, if you've got specific concerns around vaccination in pregnancy, then your community midwife or your obstetrician, if you are booked under an obstetrician, will be more than happy to talk you through the pros and cons and respond to any of your concerns and queries at that point too.
Thank you. I think this is the final question. It's, can I know you alluded to it in the presentation, Jen, but can I take my children with me to the vaccination centres?
Yes, you can. We are child friendly here. You can bring them. They obviously will then be able to see you having your vaccine, and that's not a bad thing, because we know that children have to have their own vaccinations at various times as well. So having that normalized and seeing someone having vaccines is not a bad thing at all. So it's something that can be a useful thing to help your child have their own vaccinations when they're older. So it depends on the age of children, but we have obviously those childhood vaccines, that so really small little ones, but then they have preschool boosters, then they have vaccinations for HPV and things like that, and then school leaving vaccines, and then if holiday jabs. So vaccines are a thing within our healthcare system, and an offer to all. So are there any other questions, Katie? We have, and yeah. I'm just gonna we've got one. Excellent.
One's just come through on the Q&A function. So there are lots of reports of adverse side effects to mum and baby on the VAERS, which makes me undecided to get the vaccine. What's your advice? My concern is it's such a new vaccine and doesn't have years of research or long-term effects to mum or baby.
So I think although this specific vaccine doesn't have years of research, we actually now have 12 months of research, which has demonstrated that we haven't seen those adverse outcomes in increasing amounts compared to women who weren't vaccinated. So if we compare a year before COVID vaccination was around to the year that we've had since COVID vaccination has been implemented in those cohorts, we have seen no changes in those adverse outcomes that we would expect to see related to pregnancy. So we look at things like the growth of babies. We look, dogs barking in the background. So we look at growth problems, we look at congenital anomalies that babies may develop. We look at things like stillbirth, we look at preterm birth, and we compare the cohorts of women who have received the vaccination to the cohort of women who are matched to those that haven't, and we've seen no change in the women who've been vaccinated. So we've seen no increase in adverse effects when we've looked at the data, and we have on average around 650,000 women a year in the UK who give birth, and for the women who have received the vaccination compared to those that haven't, we've seen no change in outcome in the vaccinated cohort. So for me as an obstetrician, I wouldn't be speaking publicly and saying this is something that I would encourage, that I would have were I pregnant, that I would encourage my sister to have, that I would encourage my daughter to have in the future. I wouldn't be suggesting this if we genuinely didn't think that this was safe. And in terms of the outcomes, the only poor outcomes that we have seen have been those that have been linked to acute COVID infection. And actually we have a way of preventing those harms and increasing evidence that shows that women who are vaccinated, even if they catch COVID, have a much less severe course and are relatively protected against those awful outcomes that we're seeing, like stillbirth, like women in ITU. So I think, although it's scary, although this itself is a new vaccine, the technology and the evidence behind developing that vaccine is decades long. We have got long histories of vaccinating women in pregnancy. So we've been vaccinating women against flu for a decade. Whooping cough is a really interesting one, because actually the whooping cough vaccine that women take in pregnancy is designed purely to benefit your baby. So the effect of that whooping cough vaccine is for that passage of immunity that you develop and then transmit to your baby. It doesn't give your baby whooping cough, it doesn't give you whooping cough. It allows you to develop immunity that then passes through the placenta to the baby, so that when they're born, in that period of 8 weeks while they're waiting for their first set of vaccinations, they're protected and they're not vulnerable. And so we're using that technology and we're using that evidence to help support those choices that people are taking to receive that vaccination. And hopefully that's reassuring data for people.
I've just seen that there's another question just adding in onto this one about does that go for mums who've had the vaccine during breastfeeding whilst not whilst pregnant? And yeah, we haven't got any evidence at all of any adverse effects for either mums who are breastfeeding or babies who are breastfed. Now, I had my first vaccination while I was still breastfeeding, and for me, I was really keen on having it done obviously for myself, but also I wanted to be able to give my son a little bit of immunity, what I could, and he's obviously still far too young to be vaccinated, and so the only immunity he has against COVID is what he could have got from that breastfeeding that I did. So I personally found that was a really that was something that I wanted to do, and I felt quite, I don't know, it felt good about doing it. But I do understand also that you get very worried about what you should be doing. We tell pregnant women, don't take a paracetamol unless you feel really ill, and I think that probably that's a little, we've got a little bit too far potentially with that. And actually there are some things that we know are really quite safe, like a paracetamol, like a flu vaccine, and like the COVID vaccine. And actually it's much better to be able to be proactively kind of treating things and getting ahead and preventing stuff, in this case with vaccination, than allowing the infections to get in and causing that harm. I think there's another question actually just coming about, do we have any statistics of currently vaccinated women in pregnancy? Now, I did think we did put in some statistics earlier in the slide there about how many women were vaccinated, but I'm not, so we have found that there hasn't been any negative side effects from women who've been vaccinated. And there's, I think it was 185,000, 187,000 women that have been looked. Susie, do you have that to hand?
Yeah. So within the United States, the studies that have been reviewed have looked at more than 185,000 women in the United States and over 100,000 women in the United Kingdom now who've received the vaccine and been vaccinated through pregnancy. I think the worldwide studies that have been evaluated have similar numbers in them. So we have got robust data, and the question earlier about looking at 50 women and that being quite a small sample, absolutely agree, but we're talking about hundreds of thousands of women. And certainly we know in terms of percentages, pregnant women are one of the lowest sort of vaccinated percentage-wise cohorts that we're seeing. So although we're looking at around the country seeing that approaching 90% of people have received their first dose of vaccine, in pregnancy that number drops to the mid 50%, which is leaving a very vulnerable cohort of women even less protected. So in terms of statistics, we're not seeing adverse outcomes from women who've received vaccination in pregnancy, but we know that they are vulnerable when they are unvaccinated. And with Omicron at the moment doing the rounds, it is extremely transmissible. We're seeing numbers of 1 in 10 people infected with COVID, which means that we will have a significant number. And certainly locally with our virtual COVID wards, we are seeing significant numbers of women who are testing positive in pregnancy, which has all the potential for those negative consequences that we're so worried about.
Susie, just to add on to that, there's been a question about have those studies been peer reviewed? Now, I know that the ones that have been published, to get published, they have to go through a peer review process. And there are ongoing ones that haven't reached publication yet, which are in that process as well. But yes, everything that's been published in mainline journals I can't remember which journals they were, Susie.
We've seen publications within the British Medical Journal, the New England Journal of Medicine, and also within the slides. There was a comment earlier asking about whether the slides could be shared. I know the presentations will be up and available on the CCG website, but there's also links to the studies that have been referenced at the bottom of the slides where they're mentioned. But they are all peer reviewed prior to publication, and as Jen says, some of them are in the process. Some of the more recent data, and Vicky Mail that Natalie mentioned earlier has been collating evidence around pregnancy, fertility, periods, breastfeeding, and her Twitter handle on Twitter, unsurprisingly, contains all of the most recent evidence that has been peer reviewed and published, and then collated in one space to try and make that easier to access. So I would absolutely recommend looking her up for the most up-to-date peer reviewed published data.
Thank you. We've just had another question come in, Jen, if it's possible. Can someone guarantee it's 100% safe to have the vaccine while I'm breastfeeding my child? And where can I get the information from?
So as Natalie went through earlier, that there is no evidence of any adverse effects on women who are breastfeeding or breastfed children. There have been some, problems. So the safety is really up there. We know that it is a safe thing to do to get vaccinated when breastfeeding. So as I said, I got my first vaccination while I was still breastfeeding my child, and it's definitely something that I considered a very safe thing to do and an advantage to my child to do that. Natalie, did you want to come in on this one as well?
I think it's just about, for every person, you've got to make the decision for yourself, and no one can ever guarantee anything within healthcare. People ask us, the data we have at the moment is what we're going from, and that data shows that there is no known risk. So that is what we are saying. But you've got to make that decision for yourself. We can provide this information and we can provide links, that's fine, but you've got to always, with anything in healthcare, weigh up the risks and benefits, and then make an overall decision. And this data that we've got here, we've got lots of data now. In the time that since the vaccines have been out, we had very little to go on at the beginning, and you had to, it was very difficult to find these things. But that link I've put up from Vicky Mail, there is a lot of data that you can go through, and she actually writes it out in a way that's easy to read, which I find quite helpful, because it's difficult ploughing through things, isn't it? But at the moment, there is no known risk and no safety signals, which means that there's no concerns. I would also add that whenever you breastfeed your baby or your child, your milk is going into them, and you have concerns about everything. People worry about hair dye, they worry about, can they have a glass of wine? These things are all addressed. Speak to your midwife or your health visitor about this, but there is lots of stuff out there like Breastfeeding Network where it talks about each area, what does go through breast milk, what doesn't, and a lot of the time it's quite small what goes through breast milk, when it comes to things. And a lot of things that you're told, for example, like don't eat certain foods, there's no evidence for that affecting your breast milk. So when it comes to the vaccine, the data we have says it's safe for breastfeeding, but you've got to make an individual choice about it, and that's what we're here for. So thank you for asking that.
Yeah, and I'll follow in. I actually had to have a general anaesthetic while I was also breastfeeding, and I got really quite worried about what was that, because these are serious drugs. They're really hardcore ones. They're really strong stuff, enough to knock me unconscious, and I'm going to be producing milk during that whole time. And what's the, do I need to dump it? How am I going? Is it going to affect my supply? These are all natural, concerns. And actually, I found, when I did all the research and I spoke to the breastfeeding support workers at the hospital, that actually I didn't have to pump and dump. Actually, that there's nothing left in the that's abnormal. That it's all safe to actually carry on breastfeeding through that period, as long as you're conscious enough to breastfeed after the operation. You can do it. It's not going to be be risky for your child. So there's actually a load of information, a load of things that we would automatically think are really, we couldn't possibly do that. It would be really dangerous. Actually, when you look into it and the evidence behind that, it's actually not nearly as risky as possible, because our bodies are very clever at not allowing those things to stay, to stay in the milk for a long time. So I would talk to your breastfeeding support network people, so your health visitor can help direct you to that. And Natalie, is there a breastfeeding link support local one that you could put in that would say, so she'll be able to ask that? Because I think sometimes it's better to ask these questions face to face, so you can have that real good dialogue. And I found that really reassuring, because I had so many questions on top of a question, and then what if this question. So I don't think that anyone who is breastfeeding or is pregnant will do anything lightly. You need to look at the evidence and you need to weigh things up for yourself there. And our job is to help get you that information and allow you to make that decision, the one that feels best for you and feels right for you. So and for us to start to be able to do that, we can give information in this form, but that may not be interactive enough. That it's about getting that dialogue up and running for people. So do start that dialogue. If you've got those questions, ask them and start speaking to us, so we can give you as much information as possible. So Natalie's put that in. The local breastfeeding, chest feeding support, babes breastfeeding support groups in Nottinghamshire. She's put a whole load of them in the chat, so if you can have a little go in the chat. I'll just read some of that out, because obviously it won't be available. I'm not sure the chat would be available if you're reading it on the YouTube. So we've got babes, BABES, breastfeeding support groups in Nottinghamshire, Knott's Happy Baby Corner on Facebook, and they have an infant feeding practitioners on there that you can be referred to. Now you can also contact Natalie at Sherwood Forest Hospital, so that's Natalie Boxall, and there's the infant feeding midwives at NUH as well. So if you just ask to speak to an infant feeding midwife, you can get through. And the antenatal clinic's a good place to get hold of those professionals at either hospital. Excellent. And you can have a little on both hospital trusts websites, and if you just if you Google the hospital name and maternity and infant feeding, you usually can get through to those ones. Excellent. And if you have access to the chat, Natalie's put her extension number at Sherwood Forest down as well. Sorry about that. Now I'm going to draw us all to the close unless there are any extra questions. Katie, can I just check?
There are, but I'm just really conscious of time, Jen. So what I've done is I've asked my colleague to put the engagement email address in the chat for anybody that didn't get a chance to have their questions answered, and then we can field those and ensure that we get answers to those individuals as well.
Marvellous. Okay, so what I'm going to do is I'm going to draw us all to a close. I want to thank everybody who's been involved today. Thank Katie for fielding all these questions. We have Sam in the background, and Natalie for addressing all the breastfeeding and chest feeding questions, Susie for getting all the obstetric questions as well. Thank you all, and thank you for everyone who's attended. We hope we have answered your questions. If we haven't, please, as Katie said, please do get in contact with us. Our email address is nncg.team.engagement@nhs.net. Okay,